The Fall 2020 Hinkle, Pryor, and Fisher Parent Empowerment Conference. Realities for a New Reality. 2 days, 25 workshops, renowned speakers and presenters, by families, for families, nearly 40 hours of unfiltered and straightforward information, made possible by the leaders in disability rights advocacy for over 45 years, Hinkle, Pryor, and Fisher, attorneys at law. So welcome to this session of our ongoing encore presentation series of the Fall 2020 Hinkle, Pryor, and Fisher Parent Empowerment Conference.
Everybody who is joining us this morning. We're just letting everybody who's participating today log in and connect, and we're going to get started in just a moment. Welcome everyone, and thank you for attending the Hinkle, Pryor, and Fisher Virtual Parent Empowerment Conference. My name is Tina James. I'm an attorney here at Hinkle, Pryor, and Fisher, and I'm going to be your moderator for this workshop entitled The Basics of the Neuropsychological Evaluation. I will be your moderator here today, and our presenter is Dr. Emily Perlis. Before we begin, I'm going to ask that everyone keep their microphones on mute throughout the session, and this workshop will last approximately 1 hour. We will be taking questions throughout through the chat feature, so I ask that you put questions that you have for Dr. Perlis in the chat in the control bar, and I will ask her as many of them as I can, again, time permitting. If you have not already done so, I highly encourage you to sign up for this evening's keynote address. It is delivered by the former New Jersey Supreme Court Justice, Justice Helen E. Hones, entitled Autism After COVID-19, Navigating a World Where Everything Changed and Nothing Changed. Justice Hones is also the parent of an adult child with autism and will provide a unique perspective on the times in which we live. She's both an inspiring person and inspirational public speaker, and you won't want to miss out on that. So simply go to the conference event page, scroll down to the tab for the keynote, and sign up there. It is now my pleasure to welcome our presenter today, Dr. Emily Perlis. She received her doctorate in clinical psychology from Weiner University with a specialization in neuropsychology and school psychology. After completing her internship through Weiner University internship program, Dr. Perlis spent 2 years as a postdoctoral fellow in the Pediatric Neuropsychology at Harvard Medical School, Center for Child and Adolescent Development. Dr. Perlis maintains a private practice in Bryn Mawr, Pennsylvania, and specializes in assessment, diagnosis, and consultation for children and families affected by learning disabilities and attention deficit hyperactivity disorder, autistic spectrum disorder, nonverbal learning disorders, medical illnesses, genetic and developmental disabilities, and psychiatric and emotional difficulties. She provides a service to individuals ages 3 through young adulthood, and Dr. Perlis is a licensed psychologist in both Pennsylvania and New Jersey, and a certified school psychologist in Pennsylvania. So without further ado, I'd like to give a warm welcome to Dr. Perlis. Thank you for coming out here this morning.
Thank you so much for having me. I'm excited to be here. Before I get started, I just wanted to reiterate what we talked about in terms of questions. I think that there are going to be certain periods in the presentation that I think lend themselves to nice breaks, so you don't have to listen to me talk straight for an hour. And so at that point, I'll let Tina know that that it's a good time for questions. So please feel free to kind of submit your questions throughout, and I'll do my best to answer them. All right, so I'm going to talk about the neuropsychological evaluation to give you a bit of an introduction to that. So let me get started. Okay, so first let me review what the goals of the presentation are going to be, just so that way you have an idea of what to expect, and rest assured that I probably will be getting to whatever questions that you may have. First, I'm going to be defining what neuropsychology is and what a neuropsychologist is. Who comes to get a neuropsychological evaluation? What types of patients do I see in my practice? If you do decide to pursue a neuropsychological evaluation, what will you expect in that evaluation process? As someone who works mostly with children and young adults, I'm going to spend quite a bit of time talking about the importance of considering development when you are looking at a neuropsychological evaluation and trying to understand the results. And then, towards the end of the presentation, I want to talk about translating the results of this evaluation into really useful recommendations. And finally, a really big question that people often have is, what is the difference between the evaluation that someone will receive if they come to me versus what they might get at their school through the child study team or the psychoeducational evaluation? I'm assuming that most of the people who are here at the presentation have been told by either a physician or a teacher or a counselor that they should go get a neuropsych for their child. And so hopefully at the end of this presentation, you'll have a better understanding of what it is that this evaluation is and whether it is something that you would like to pursue. Okay, so what is neuropsychology? So the broad definition of psychology in general is that it's the study of human behavior. So neuropsychology is a subspecialty of psychology that studies how the brain impacts behavior. And we really are trying to understand how someone's brain and how their brain functioning affects their ability to engage in everyday tasks, such as paying attention, learning and memory, language development, language use, and solving everyday problems. One of the important things that we cannot do as a neuropsychologist is tell you if there's something structurally wrong with the brain. So we're really looking at behavior, not structure. So we're not going to be able to tell you whether there's a tumor or an illness or what the brain actually looks like physically. But the results can help lead people in directions. So as a field, neuropsychology draws from many different disciplines, including cognitive neuroscience, neurology, neuroanatomy, and all areas of psychology. And our tools are our tests and our observations, and that would be the evaluation process. So how do we assess the brain and behavior? So there are many different ways to do that. From a medical perspective, we can actually look at the brain, and that would be through something like a CT scan or an MRI, and that's where you're going to get the information about what the brain actually looks like. Is there an injury to the brain? Where is that injury? We could also look at how the brain is working functionally, physiologically, through tests such as EEGs, PET scans. That is not what a neuropsychologist does. I'm not a medical doctor, I'm a psychologist. And so the way we assess the brain is through eliciting behavior. Okay. So as a neuropsychologist, I just mentioned I'm not a medical doctor, but I am a licensed psychologist, and I have specialized training in how the brain works and the assessment of the brain and behavior relationships. So I have a doctorate in clinical psychology. Some neuropsychologists may have a doctorate in a related specialty of psychology, such as counseling psychology or school psychology, but we're practicing psychologists. After completing the doctoral degree, the standard course for a neuropsychologist is to do 2 years of postdoctoral training, which would provide further educational experiences and supervised clinical training in neuropsychology. So neuropsychologists will work in a variety of settings. When I did my fellowship, I was in a hospital setting, but it was also, I would say, less of a hospital medical unit, but more of a outpatient mental health setting within a hospital, and also inpatient psychiatric unit. So you'll find neuropsychologists in settings like that. You'll find neuropsychologists on medical teams. You know, there are many neuropsychologists who work, you know, in rehab settings or with individuals who have had medical illnesses or injuries that impact their cognitive functioning. I work in a private practice, and some neuropsychologists work in schools. My practice, and I think, again, considering this group, I'm assuming most of the people, you know, that you might see if you went to see a neuropsychologist would be someone either in a private practice or a school setting versus someone who might be in a medical center. The beauty of being in a private practice is that I do have a lot of opportunity to kind of work in other settings too. So I can, you know, I do work in the, there's the collaboration from amongst different settings, but you will find us in many, many different venues. So as we mentioned, I did a fellowship in pediatric neuropsychology. So I consider myself a pediatric neuropsychologist. I also sometimes will use the term developmental neuropsychology instead of pediatrics, because the patients that I see do grow up and they become adults. And so when I think of developmental neuropsychology, I think of seeing clients and patients who have a developmental concern. And so if I see someone who's 22, it's going to be because of a developmental issue that was evident in childhood, not necessarily someone who may have had a injury as an adult. So that's where the difference is. The majority of my practice is, you know, going to be people between 5 and 21. So this is where the issue of development becomes really important. So as a neuropsychologist, my training is in clinical psychology, neuropsychology, developmental psychology, and the focus on normal brain development is really, really important because we can't really tell what's not right unless we know what's expected at different points in development. And we use that knowledge to help evaluate, diagnose, and treat children with neurologically based conditions. You know, so for example, if, you know, a very obvious developmental milestone is reading, we don't expect a 3-year-old to be able to read, but we do expect an 8-year-old to be able to read. So that's how understanding normal brain development is important. And, you know, at certain ages, there's a fine line between what's typical and what's not typical. Okay, so people come to us when there's the need to assess the impact of a neurological based condition on everyday functioning. And for children, their everyday functioning is typically going to school and learning. And so that's the behavior that we're often assessing, the behaviors associated with learning and school. Okay. So who comes to see me, or any neuropsychologist in general? So there's definitely overlap in these categories, but this typically will include everyone who comes to see someone like me or another neuropsychologist. People who have questions about possible learning or attention disorders. People who have, or children who have conditions that affect their nervous system, such as a traumatic brain injury, epilepsy, or other diseases that affect learning or cognition. Genetic disorders. People who have maybe had radiation or chemotherapy when they were younger, and they're coming to see whether or not there's been any change in their cognitive functioning. Late effects of extreme medical interventions, late effects meaning things that might happen down the line. People who may have been exposed to toxins such as lead poisoning, or children who were exposed to alcohol or drugs in utero. Developmental delays of unknown etiology in children with autism spectrum disorders. In private practice, most of the things that I would be seeing are going to be the learning attention disorders, developmental delays, autism spectrum disorders. However, that's not always the case. And like I said, there's obviously going to be overlap here with what you're going to be finding. Okay. So, why would someone seek out a neuropsychological evaluation? They want to know about a child's cognitive and learning strengths and weaknesses to help understand how this child is learning and to assist in educational planning. That's the 90% of the people coming to see me are coming for that reason. There's also other reasons that someone would come to see me or to see a neuropsychologist. We want to look and see how someone might be changing over time. So if someone had an injury or an illness when they were younger and we assessed them at that age, a few years later, are they making improvements? Are things changing? So there's that monitoring over time piece. People might come to me who have been evaluated by their school district and they still may not understand really well what's going on with their child, and they want more information, or they may want a second opinion about what's going on with their child.
Dr. Perlis, I have a quick question on that, because, what can a parent do to, if they have that situation where maybe they've been evaluated by the school, but what can they do when they're preparing to see you? Like, what information is helpful for them to gather and bring when they're deciding to make that appointment?
Absolutely. So when I move forward in the talk, I'm gonna talk about what to expect in the evaluation, and we're going to talk about the interview and when we're doing the evaluation, there's going to be a lot of different pieces that we're going to be integrating, and background, history, and is so important. It is so crucial, and I will definitely talk about that when we get to that part. And I think that if there's still questions about that, I can certainly be much more specific. And it's going to be different for everybody anyway, because everyone's coming from a different place. Some people kind of bring in, like, as you know, like, they have filing cabinets full of old things. Some people don't have anything. So it's going to be very individualized, but very important. So, okay. So other people who would be referred for a neuropsychological evaluation may be referred by a psychiatrist if they have, if their original concern was more of a behavioral or emotional issue. Sometimes psychiatrists really want to get the information about whether there could be a neuropsychological or learning component to what's going on. Really, the kind of bottom line here is that we're really trying to understand, it's just information gathering, and it could be information gathering for various reasons, to help evaluate programs, if you're doing a specific educational intervention now, is it working? You know, we have point A, a year later, is this child's reading better than it was a year ago? And then, as I mentioned, this whole developmental neuropsychology piece is, as someone becomes 20, 21 years old, we need to help support people in their transitions in life. And we need to make sure that we understand what people need at different points in their life, whether that's the transition to kindergarten, the transition to middle school, high school, college, post-secondary life. And so these are the reasons that people will come for a neuropsychological evaluation. Okay, so now I'm going to talk about the assessment. So hopefully we'll be able to help people understand kind of what to expect and how to get ready for the assessment. This is just a definition that I kind of like, that I think really kind of encapsulates the process overall. It's an intensive study of behavior by means of interview, standardized tests, scales tests, which are kind of the same thing, and questionnaires that provide relatively precise and sensitive indices of behavior. And again, when I'm talking about behavior, I'm talking about learning, language, behavior that we think of as behavior, emotional functioning, all these things that are what we talk about when we talk about behavior. Okay, so what to expect. So this was actually, Tina, a time in my presentation where I thought if there are any other questions about what I've talked about, if nobody has any questions, we can move, I can keep going, but.
I had just received that one so far, but I'm sure, you know, I know a lot of people started logging in a little bit late, so I'm sure there's going to be more coming.
No, it was just kind of a natural break because I'm moving on to now the evaluation process. And so this might, you know, you may all have more questions about this, so we will see. Okay. So what to expect. So there are various components to the evaluation. The first thing that we're going to do is have an interview. We're going to talk about where have you been and where are you now with your child or young adult, who, you know, the person being evaluated. And this helps me, or the neuropsychologist, provide a historical context so we understand where the current presentation, what's the history there. This interview is going to seek to intimately understand the developmental, medical, academic, behavioral, and social history. And this is where the documentation of old evaluations, any sort of school records, medical evaluations, anything that you think might be relevant. What I usually tell people to bring me is everything. And having done this for a while now, I kind of can look at something and know whether or not it's something that's going to be useful for me. And sometimes it's going to be different for everybody. So I would really want, you know, to people to not feel, you know, intimidated if they want to bring me sackloads of stuff. That's totally fine. It really helps me to know the history in so many different ways. And so that would be something to definitely be prepared for if you go for this type of evaluation, is to really try to kind of get all of the documentation in order. It's really important for us to see old testing that may have been done, because again, we're going to be looking at that change over time to see, you know, whether things are trending in the same direction or if things are changing, and it's really helpful. Sometimes people get worried that me seeing old testing might make my bias, you know, my findings. They want kind of like a clean slate, and you know, I understand that fear. But again, when you understand development, you understand that even if someone, when they were 3 or 4 years old, may not have may have had a hard time with attention or behavior, that might not be the case anymore. So, it's helpful for the practitioner to have the old information. Then that piece is part of it. And then I also have parents and usually teachers or other adults who know the child well complete behavior rating scales. And the reason we do that is because it helps to quantify the behavior that is being talked about in the interview. So you could say my child has attention issues, behavioral issues, but what the behavior rating scale does is helps me put a number on it, and compare what you see to what would be typical of someone your child's age. And also getting the perspective of different people is really helpful as well. So that way we can see whether there's differences in different settings. And sometimes this, everyone has a different kind of level of what is a problem. So sometimes even two parents who are in the same house may have different perspectives on behavior. And kind of understanding that dynamic is really helpful.
Dr. Perlis, we had a question come in, and this really separates the underlying reason for the neurological evaluation. And one of the questions is, if a school requests it versus a parent requesting it, how much background information should the parents provide? And the concern is that if it's requested by the school, it might be perceived, at least from the parent's perspective, as an invasion to that person's privacy.
Well, it's interesting. I mean, I think that that's probably something that the parent in this particular case should try to work out with the school. I mean, so I would say maybe 30% of the evaluations I do are kind of independent educational evaluations. I'm sure we'll talk about that later too, what that is, and which means that the school is funding the evaluation. I take the perspective that I really truly am an independent person who will get the information and make my own opinions on it, regardless of who is paying for the evaluation or making the referral. So I think that if I get school records, if there's any concern, the parent should feel very comfortable telling me that and saying like, well, this is what this might say, but this is my perspective of that. So I think that, obviously everyone can make their own decision. And if they don't feel comfortable, with the whole process, that's ultimately going to be an individual choice. But I really, really feel that my job is to be kind of the advocate for the child and the patient. So I really, really try to do that in my practice. That's why I like to get everybody's perspective.
And from a privacy issue, from a legal perspective, the school has, a legal obligation to provide that child with the education and the accommodations that are necessary. And while it is a privacy issue, at the end of the day, you're right, that the child is the one who we want to be making sure gets the best education that they're, not only that they can, but that they are legally entitled to. And even though it is delving into that privacy, I think it's important to have that information out there so everybody can do their job.
Yes, right. I mean, I think part of it is just trusting in the process.
Right, and that's sometimes
that can be
hard.
Very hard. I totally understand that.
Right, and so we have some more questions coming in, and I don't know if you're going to hit on these when we talk a little bit more. What the question is, and you did touch upon this about the independent evaluations, but without referring to the past evaluation, especially if the parent disagrees with that. And I just don't know if you want to maybe just reiterate what you had said or add anything to that.
Yeah, I mean, I think that I would say anytime someone's coming for an independent evaluation, I mean, it's very, very rare in my practice that a school district is just going to say, oh, let's do an independent evaluation. So almost all the cases that come for an independent evaluation, there's a disagreement. So I know that going in that people are not on the same page.
Yeah, and this actually, the follow-up is if parents have their own medical disabilities, their own medical health issues that do impact the child, but they're worried about that being
Okay.
imparted to the school. So that actually does add another layer, but which I imagine is very important for you.
Yes. I mean, there are times when there are things that are relevant and there are things that are not relevant. And you know, we make that decision on a case by case basis. And so sometimes a parent's history is not going to necessarily be included in great detail because it's just not relevant.
Right.
Now, if it's relevant, then that's a different story. And we need to kind of talk about that. But I don't think that, I think that, I guess I only could speak for myself. And like, I try to be as sensitive and as independent as I possibly can. And hopefully, communicate, my decision, the reasons for decisions I make as a practitioner in a way that is understandable that everyone understands. And therefore, it doesn't become a big issue. But I would never want to do anything that would make anyone feel uncomfortable. Of course. And there's definitely not, whether or not someone has a specific history 20 years ago, like that's probably, we talk about that, whether the relevance of that.
Great questions, everybody. Keep them coming.
All right. Okay. So what to expect in the evaluation process. So this is actually a really interesting piece that I really, and I think might change in the near future because of COVID and some of the limitations that I will have to kind of adhere to. So when I'm doing an evaluation, the test data, which is the next thing on the list, is really important, but also observing behavior. And when I talk about observing behavior, I'm talking about it in the evaluation process, but also outside of the evaluation. I mean, when someone comes to my office, it's a one-on-one setting. I can look and see how they react, how their social communication skills are, what's their attention to task, how are they responding to frustration, in different situations. And that's really important piece to the testing because it's important to see how someone reacts in that situation, but also there could be implications to how it affects the results and kind of what we can how we interpret the results. For me, especially for school age kids, observing in the school setting is really important. It's a really important part of my evaluation process because it's more the real world. Again, what I see in my one-on-one testing situation is not necessarily going to be the same thing that a teacher is seeing in a classroom with other kids. The demands are different. The attention on the child is different. So I really, and also I think a lot of parents like this piece because it gives, it's not just, when I'm gathering information from a teacher versus via a behavior rating scale, that's one thing, but this is a way of me seeing kind of what's happening in real time. Now it's only one time usually, sometimes it's more, there's always flexibility. However, this is going to be something that, we're going to have to see how this plays out because I don't think that many schools right now, first of all, are not in session. Or if they are, they're not letting, outside evaluators come in at will anymore. So, I have seen a little bit of a change in even who's calling at this point because for a lot of people, and I don't know who's on this call, but that school observation is such a important piece. They really want someone to go into the classroom to see what's going on. And without that, it can become harder to make recommendations about things like placement or class size or things like that. So, that's something that we're going to have to see how that evolves. And I'm sure the attorneys are much more on top of that situation than I am right now.
Was going to say on the attorney end, a lot of it's still we don't know, we're watching, things
Right.
are evolving. But yeah, this is my own personal question that I had. You talk about school observations. Have you had anybody request an observation of their child at home doing homeschooling?
Not yet. I have, well, I mean, that's not true because I have seen kids in the past who are on in cyber schools. And so I have done that.
Okay.
I have gone to people's houses and watched their kids do school. In the spring this year, I joined a Zoom call for a student who was doing a Wilson reading program. So I watched that. So there has been some of that.
Right. Because I imagine one of on the legal end, we're doing talks about the schools. The question is always my child's struggling at home. We can't do this evaluation because the schools are closed. What can we do? And I was just wondering if that's even come up yet.
Yeah, no, it hasn't come up, but I think we're kind of we're in this, the first few weeks of school, like are usually I'm not getting tons of calls, but by October, November, I think that we might see more of that. And I think some of that's going to just have to be kind of a personal thing between me and whoever's calling, because I think there's probably going to be different tolerance levels for strangers coming into people's houses.
Fair enough. Yeah, absolutely.
And knowing what my exposure risk is versus their, so that's something that, I would certainly be, like I said, in normal times, I've done that. I've gone to people's houses before. Sometimes I'll go to people's houses for kids who parents are really concerned that the office setting is just too challenging. And I think that that's not typical, but one of the beauties of being in private practice is that I have a lot of flexibility. So I can really do pretty much anything I want with respect to how I, kind of conduct the evaluation.
It's interesting.
Yes. I've done
Good to know.
Yes. So then the last part is the actual testing, which is like the bulk of the neuropsychological evaluation. And this is going to vary depending on how old the child is, what the specific question that's being looked at is, or even what the setting that you're working in. So in my practice, the typical kid, if we're talking about a school-age kid who is able to sit through a testing evaluation, it's up to 6 to 8 hours of testing, and that can be conducted over 1, 2, or 3 sessions. Depending again on a person's age, their tolerance. It's very rare that I do it in one session unless someone is, a teenager with mild difficulties. It's very exhausting for me, for everyone to do this for that long. But for someone who might not have a lot of language or who may have limited attention span, we may not be doing that much testing. Sometimes the standardized testing isn't the most important part of the evaluation. Sometimes it's the behavioral observations. Sometimes it's the rating scale. It really depends on the person. In this setting, when I say 6 to 8 hours of testing, I'm really talking about kind of what most of the evaluations will look like in my practice. But again, like I said, you can do these evaluations in a rehab hospital, and they're not going to be 6 to 8 hours of testing. They're going to be looking at very specific cognitive issues and kind of tailoring the battery to that. Okay. And now we've kind of talked a lot about this already, but the whole process is, ideally a collaboration between teachers, school administrators, therapists, physicians, et cetera, to really try to just gather as much data as we can. It's just valuable for me to be able to kind of get that information. I only get to work with these kiddos, I get a snapshot. And it's a lot of time. After 6 hours, we definitely get to know each other, but it's not the same as, day in and day out interaction. So does anyone have any other questions at this point? because I'm going to start moving on to what the actual test battery looks like.
We did have one other question come in, and just two housekeeping items because there were some questions regarding them. Somebody asked about Dr. Perlis's handouts. If we will be making handouts or her slides, if she is able to share them with us, we'll make them available after the presentation, after the whole conference, to all of the participants across the board, as we did back in the spring. So that was one. Somebody had said they are having a little bit of some audio problems hearing everything. Just want to let you know we are recording this. Same thing, that'll be available on the back end. Dr. Perlis, you're coming in loud and clear on my end.
Okay.
So don't know what that is. I do know this is a time when a lot of kids are on school, doing school and things from home as well. Right. But we are recording it. So if you missed something, that will be available again after the conference. And so this other question we had said, how would you evaluate a child who cannot process long connected speech, intellectual disability, and who is a visual and experiential learner?
So, right. And so this might be someone who we would be a bit more creative with. So and the testing battery itself might not be quite as lengthy. We have tests that are nonverbal. So we use visual cues, hand gestures. I mean, these are all standardized tests, and we're going to talk about that. So there are different tools that we might use for different kids. And a student like that might be someone who we were looking at going into the classroom under normal circumstances might be really important, because we might be looking more at how are they responding to their educational program, how are they, and so it might be a bit more of a qualitative in some ways than necessarily relying on the standardized test battery. I mean, the truth of the matter is when someone may have a really hard time engaging with the tests, the utility of them might not be quite as high, because it might only be telling us what they can't do, not what they can do. And we don't really only want to know what they can't do. And so that's where kind of being a clinician comes into play, and really kind of thinking kind of outside the box to try to figure out what might be going on. Does that answer your question?
We got a thank you there, so I'm assuming that did.
Okay. Okay. And I mean, and again, every individual each case is individual. So if you do pursue an evaluation, you'll talk to the clinician about your concerns, and we'll come up with a plan. And there are going to be limitations, and that everyone has to know that. And I think that's a really important piece, that that having this communication with the practitioner is so important, because sometimes you'll get an evaluation, and this is where that kind of coming in for a second opinion or kind of an after school evaluation is it's sometimes hard to understand like what it all means. And kind of if you get this report that all it shows is like what your child can't do, that's not super helpful. And so kind of being able to have a relationship with someone who can then sit down with you and be like, okay, this is what this means, and this is how we're going to, is really that. And that's at the end of the presentation when we talk about kind of putting all the findings together and the recommendations. We're not doing that. We do this for a reason. It's not just to kind of create paperwork. We want to help. All right, so this is a standardized test battery. So as a neuropsychologist, these are the areas of functioning that I'm looking at. Now, in most cases, we'll be looking at all these skills. In some cases, we're not. Sometimes not everything is relevant. So intellectual functioning is kind of like that IQ that we all hear so much about. And then kind of looking at the different areas of cognitive functioning that we look at are things like attention, learning and memory, language skills, visual spatial functioning, sensory and motor functioning. For someone like me, it's more fine motor, not necessarily like gross motor functioning. Executive functions, which I'm sure a lot of people have heard a lot about. Academic skills, emotional and psychological functioning, and then adaptive functioning. And so I have prepared to talk a little bit about each one of these. Now, this might not be as interesting for everyone, so I might kind of go through this quickly. I get the sense that more people are interested in actually like probably how to use the evaluation report, so I'm going to go through this really quickly. If you get an evaluation from someone like me, there will be these sections will be covered using various different tests. So in intellectual functioning, what I might do is just talk about the different areas and some of the tests we use, because if you have had an evaluation done through your school, you may have heard of some of these tests. So it's kind of helpful to kind of understand what they're actually measuring. So when we discuss IQ, we're really looking at kind of what is an individual's kind of overall general in cognitive functioning. So the components of an IQ test are usually and typically include verbal reasoning, how does someone think with language, use words, understand how things relate to each other. Nonverbal reasoning is how do we make sense of information that's not language. And so we assess that through things like pattern completions, understanding the relationships among kind of visual images. Most IQ tests also have a working memory and a processing speed component too, to kind of look at more fluid functioning. So how do we put all this stuff together? And generally the IQ test is used to kind of help understand what we might expect in other areas of functioning. It kind of gives us the idea is for it to give kind of a general idea of where someone is relative to other kids their age. Tests of IQ tests that you often see would be the WISC, the Wechsler scales. So that would be the WISC for kids, the WAIS for children 16 and up, the WIPSEs for younger children. And then some other tests that you often see are the Stanford-Binet, the differential ability scale, or the Woodcock-Johnson test of cognitive ability. I'm sure if any of your kids have had evaluations done, they've had one of these tests. And the utility of, what the IQ is it's a debate for another presentation. And I think that understanding what it can and can't do is extremely important when you are working with kids. And I think the person who asked the question about a child who's not able to communicate well, clearly understanding the limitations of our tests is as important as understanding what they can do. So assessing attention and working memory is so important because, without attention, really, we can't do anything else. And so it really is an important thing to kind of get a really good sense of, like, so how well is this person attending? And we can look at someone and see what we think, but our tests help to quantify that. And we're looking at lots of different types of attention. So sustained attention, how do you pay attention over time? Divided attention, how can you pay attention to more than one thing at once? Brief attention. So some of the tests that you might see in a battery that look at attention are things like a continuous performance test. So that would be the child has to perform a task over a sustained period of time. And usually the idea is to try to make it a test that's not really cognitively challenging in any other way. So that way we're really looking just at attention. And then digit span is a test that's on the IQ test that a lot of people are familiar with. And that's really looking at kind of a short attention span. So, I read a series of numbers and then the person has to tell it back to me. Okay, memory. I love using memory tests. And this isn't something that you often see in school-based evaluations. So this is something that is somewhat unique to a neuropsychological evaluation, but that's a generalization. So every school is going to have a different person doing it with different background. But when I'm looking at memory testing, I'm looking at how someone acquires new information, how they store it, and how they can retrieve it at a later time. So we really look at memory in a lot of different ways. We look at verbal memory, we look at visual memory. So some tests of verbal memory are going to be more language based. So reading a story and then telling it back. So that's definitely a test of memory, but it also has language is a factor there. So kind of my job is to kind of try to figure out where, if there is a breakdown, where is the breakdown? Is the breakdown in acquiring information and learning it? So if I look at two different tests of memory, one that has a lot of language and one that doesn't have a lot of language, is there a difference there? I'm really trying to analyze how this individual in front of me kind of brings in new information. And, you know, for children, most of the time memory itself is not a problem. Memory itself kind of is more of a issue for, unless there's a brain injury or something really medical, that would be impacting memory. Most of the time it's a difficulty in acquiring the information to begin with. So that would be either because of attention problems or language processing issues, or retrieving the information. So retrieving the information would be if I say after half an hour, tell me that list of words I read to you, earlier. And some kids may not be able to do that, but if I give them multiple choices, they're able to do it. If I give them cues, they're able to do it. So really trying to kind of, again, analyze how someone approaches these tasks is really helpful. And that's where a lot of the recommendations come in terms of, okay, well, when you're in class, how can we maximize the learning and memory? And the last point here is about when people complain of memory problems, it can often be explained by other factors. And this is what I was mentioning with attention or language retrieval. And that's, okay, so speech and language, many of the students who come to me have had speech and language evaluations by pathologists and speech and language pathologists, and these are certainly going to be more targeted, obviously, to speech and language. I think that you can't really talk about the brain without talking about language. So that's, why this is certainly part of our evaluation. I think that it doesn't typically go into as great depth, things like articulation. That's, not something that I look at as much or at really kind of in a systematic way. It's obviously a behavior we would note, but really I'm looking at is overall communication skills. So how is someone understanding language? How are they using language? Definitely in noting things like fluency, how they use the structure of their language, how are they understanding language? And we're certainly going to have tests that look at this. There's some overlap, but there are definitely times after my evaluations where I'm like, I think we need to get a much more in-depth look at language. And that's where I might refer to a speech and language pathologist if one of those evaluations had not already been done. Okay, and these are some of the tests of speech and language that people might have oops, I see a typo there. Clinical evaluation of language fundamentals. And these are some of the tests that people might encounter in a speech and language evaluation. Okay, visual spatial skills are honestly basically just that, how do we interpret visual information, and really trying to kind of remove the language piece. So things that you might see are copying block constructions, drawing pictures, being able to judge orientation of lines. These skills are not as easy to identify always as language because we don't use them, or they don't seem as important kind of in everyday life, but they are really important for things like writing, organization, navigating your surroundings, and academically and things like math and that sort of thing. So sometimes deficits in these areas present in more of a subtle way, and sometimes not until someone's a little bit older as well. Motor functioning in a neuropsychological evaluation, really we're looking at it. Sometimes we're looking at, as the root of our profession is in kind of the brain injury world. So sometimes we're looking at is there a difference between the left side and the right side of the brain? Because that can help give us some information about how the brain is working. We're also looking at it really for functional reasons like writing, kind of speed of work. And a lot of times students who have learning issues are going to have fine motor weaknesses, even if it's not necessarily obvious. It's a little bit of an indication that there might be something else going on. Executive functioning. This is, again, another talk that I'm sure a lot of people have heard a lot about executive functioning. And it's a variety of processes that help us guide our behavior, organize ourselves, initiate tasks, manage our different thinking skills and our emotional life and behavioral functioning. The analogy that's often used is it's like the conductor that helps bring everything together and coordinates the more basic processes like attention, and helps regulate it and helps regulate our language use and regulate our behavior. So the tests that we use are looking at things like problem solving, planning and organization, working memory, which is, again, kind of short-term manipulation of information in your mind. Flexibility, being able to kind of do more than one thing at once and not fall apart. Inhibiting behavior, so not being impulsive, and speed of processing and kind of keeping pace. So these are the things that our tests will look at. Directly. We're also going to be assessing executive functioning because it can be a bit more of it's a very high level type of process, looking at rating scales, because it helps to get a qualitative understanding of what might be seen by other people. And then academic achievement. Now, my evaluations are always going to have academic testing, because so many of the people coming to me are coming to me because of learning and school-based issues. And we're going to be looking at kind of the same in this area as what you might see in a school evaluation, like how does someone read, decode, understand, or fluency, math, computation, problem solving, fluency again as well, writing, spelling, grammar, organization of their writing, and some of the common tests that you see that I'm sure some of your kiddos have had are the Wyatt, which is the Wechsler Scale of Achievement, the Woodcock-Johnson, the Kaufman Test of Educational Achievement. Sorry. So adaptive functioning. Now, this is definitely not something that I would look at for all kids who come to the practice. This is something that we look at for kids there might be a question of whether there's an intellectual disability. It's definitely also something that I use a lot more for individuals who are older, who might be transitioning to adulthood, because it's really looking at, okay, we want to know how you're using your skills in everyday life. So the definition that I use is the independent performance of the day-to-day activities necessary to take care of oneself and get along with others. So we're not talking about just our use of language in isolation, but how are you able to communicate with people in the community, with your caregivers, with your friends? How are you able to use your academic skills functionally? Are you able to read information in the community that's important for your everyday well-being? Taking care of skills at home, cooking, really basic kind of home living skills, and safety awareness, caring for your own personal needs. How are you able to, when I say capacity for self-direction, I mean really independence. How independent are you? And most of the time, especially for younger children, we really assess this through a rating scale. So a parent will tell us what their kid can or can't do. As people get older, I do have some standardized tests that look at that. And, it's kind of more asking questions. So what would you do in this situation? Or what would you do in that situation? And it really helps to kind of paint a picture of what someone's needs might be with respect to supports for beyond schooling. And then finally, behavior. Most of the time, this is also assessed via rating scales through parent, teacher, I'm also looking at your child for many hours so I can see different behaviors and different, response to frustration, whether there's anxiety about performance, whether there's just kind of general social interaction skills. And then again, this is another area where school observation is really helpful because I could see how someone's, how they respond to the classroom expectations. Or many times I'll say, let's do an observation in the classroom and then on the playground. How is the behavior on the playground? And so again, all of this is so important when you're considering the results of other testing. Because if someone is really anxious or shutting down during the testing, I have to note that. I can't, I have to make sure that that's all understood, that there could be some limitations based on this. And some of the tests that you would see for emotional functioning are the BASC, CBCL, Beck inventories are more are self-rating scales where someone's reporting their own level of anxiety or depression, and we have those for children and adults. Okay, so that's another area. So we could stop now for questions if you have any.
So the only one that came in was asking if you were going to hit on the emotional and psychological slide, and you did right after the question came in. So, I mean, I guess everybody is thinking like, okay, so all these tests, then what, and I guess that's really
right.
where we're going next.
Right now, yes. So, and obviously, the emotional behavioral piece is really important. And again, it's knowing one of the things I think a lot of people are concerned about, so is if my child is so anxious and so inattentive, like how is any of this valid? How is this going to tell us? So what I try to do is, we do make a statement in the report about whether we think it's valid. But I do think that it's, if we're really trying to get a sample of behavior and understand how someone is going to function, some of that, the results of testing is important, but it's also, very important information to know if someone's, so anxious that they can't get through their day, like that's where we need to intervene. It helps us know where to intervene first, because you can't get to like the reading if we can't have no attention span. We can't get to the reading if we don't have an ability to manage any frustration. So it really helps to help figure out where to intervene.
Just a question that I had: when you're doing like an independent evaluation, you'll look at obviously what maybe the school has done previously with their evaluations. Will you repeat those same tests, or will you come at it on a different angle?
Well, there are some, it depends on how long ago the testing was done. If there's a recent testing done, I don't repeat the same tests. There's definitely there's this idea of practice effects. So there are certain tests that definitely have more practice effects than others. So if I'm going to give someone a test like the block design test, which is something very novel that most people haven't seen before unless they've been tested before, there is this chance that if I give you the same test, soon after, within a few weeks or even a month or two, like you're going to benefit from having seen it before. Generally, and this is definitely not in the research literature, there is no like defined period of time where it becomes okay to give it again or not okay to give it again. A lot of people think there is, but there isn't really. So there's always, I think, general practice, people usually wait a year between certain tests, but trust me, we've looked. But I also think you need to understand the test and what you're giving. So if I'm giving a reading test, in the absence of teaching someone how to read, I'm not going to really see that much of a difference 6 months later if I give them the same test again. There's less of a practice effect because it's not like a new novel thing that they've never seen before. So it's different tests are going to have a different threshold of when, of how you have to consider the practice effects. But generally, I mean, if someone comes to me with an evaluation that was just done, I usually redo tests using different measures. So I like to personally do the whole thing again. It just makes me feel like I'm getting all of my own data. I like to have that. So if they had one IQ test, I might use another IQ test. Some other practitioners might say, well, we don't need to relook at IQ because it's already been done. or, but I like to personally, I feel like if someone's looking for my independent opinion, I feel like I need to redo some of that.
A very specific, slightly specific question as to whether you've ever evaluated someone with misophonia. I'm hoping I'm pronouncing that correctly. It's selective sound sensitivities.
I don't think so. I mean, I may have, but nothing's coming to mind.
Got it. Okay.
Yeah. Okay, so what do I do? I mean, I have a ton of information at this point after the testing, after all the information gathering, and really like this is where I try to make sense of everything. So I integrate it. I look at the history. I think about the observations and the rating scales to provide first a description. So what is going on here? This is what I'm seeing. This is what people are reporting. What is someone's strengths and weaknesses? So, okay, they're doing great on all these tests of language, but they're really struggling whenever they have to use their visual system or their visual spatial skills. When I'm interpreting the report, I'm considering development. So again, someone might come in and say, oh my goodness, my child cannot sit still. He's not learning to read. But if this is a 5-year-old, then I'm not as worried than if it's an 8-year-old or a 9-year-old. And sometimes people just, are they have children. A lot of times people compare their children, and some children are remarkably still when they're young and some aren't, and there's just kind of really understanding that piece is really important to interpreting the results of testing. And sometimes people are really shocked when I say, listen, the test shows that there's really no problem in this area. And sometimes it's really hard to kind of reconcile that, but you have to consider development. It's really, really important. And this is where kind of my training, these last two areas is where being trained is really kind of the important piece. So if I know what someone's strengths and weaknesses are, okay, well, what does that mean for how their brain is working? And I don't, in my evaluations, because of the setting I'm in, I don't often like talk about the brain. If I was working at CHOP or in the neurology unit, a lot of times those physicians want to know, does this profile, like, is this consistent with left frontotemporal, this, functioning? And that's not necessarily something that parents need to worry about in most cases. And oftentimes in children, it's really hard to really pinpoint that anyway, unless they have a very clear injury or clear medical issue. But for the most cases where there's a learning issue, developmental issue of unknown origin, it's not necessarily something that I pay that much attention to in my reports. But what I do pay attention to is does this pattern fit a specific diagnostic criteria? Is this what we see in children who have dyslexia or a specific language disorder or a nonverbal learning disorder? I think that's really much more useful for most of the people coming in private practice. And really kind of using all the data to then kind of help people understand if there is a diagnostic category is really helpful. And this is kind of also where development also becomes into play. Really, all of the diagnoses or different disabilities that we see, there's typically a very kind of, there's usually a developmental progression. And so I want to know that, does this person's presentation and, what they look like now, is it consistent with their development? Calling something dyslexia may not, it's not just, we need to consider what was happening in the first 5 years, 7 years before we say whether it fits that criteria. So we're using the test data, we're using all the history, to help understand what's going on now. Okay.
I just want to let everybody know we're about 10 minutes after 10 right now. We want to make sure that we do wrap up a few minutes early so the next group that's starting at 10:30 can get online and get started. So if you do have questions for Dr. Perlis, please make sure you start sending those into the chat feature.
Okay, well, thank you for the time. I don't have a clock around here, so I didn't realize we were that far in. Okay, so this is actually a really good time for questions, because we're really going to talk about recommendations now. And really, I mean, that's the whole point. I mean, the whole point of this evaluation is to figure out what to do next. So, they should be individualized, practical, and meaningful recommendations that really come from the data. They should, we need to look at, if we know that a specific intervention works for a specific disability, and I'm using dyslexia because it's one of the most common learning disabilities, and people kind of know about it. We definitely will make recommendations that are specific to that diagnosis, but the whole point also of doing the evaluation is to look at how this particular person is learning. So we want to make sure that, if this particular child is having issues with something else too, that we're addressing all their needs in a very individualized way. And so the recommendations may include kind of standard interventions, but also specific to this individual child. The other point of the recommendations and in the report is to just really to educate, is to help you understand what's going on with your child diagnostically, but also kind of more holistically, and to help the other people working with your child understand what's going on with your child. And that would be the school teachers or other therapists working with your child. Okay. So now this is kind of digging a little bit deeper. So, for the school age child, some of the questions that I would some of the things I might address in my recommendations would be things like, does this child need special education? Now, some people are coming to me deep into the process, having had interventions for years, but some people aren't. Some people are kind of at the beginning of their journey. And so they're asking, does my child need special education? And so I do make that a recommendation if it's appropriate. Now, there is definitely a difference between what I do versus what a school district does. And so being a school psychologist, I have to understand the language of the school district. And so, I'm definitely considering that when I'm making this recommendation. It's not just, I want your child to have special education. It's more that I understand what qualifies and what doesn't qualify, and kind of make the recommendation based on that. Having IEPs from the past is also very helpful for me, because I could help kind of refine with some of the information that I get from the evaluation, some of the IEP goals, and also the specially designed instruction. So we could say, like, maybe we need a goal for writing. This isn't something that's in there right now, but like the testing results are showing that this is an issue. And I try to do a really good, there is at times this advocacy, where I kind of have to defend my recommendation, because I'm communicating it to other people. I'm not always there to do that. So if I say I think something has to be a goal or a recommendation, I explain why. And again, that all goes back to what the data is telling me. So if I use the data to support my recommendations. Okay. In terms of progress, this is where kind of the repeated evaluations go. So, you want to refine your recommendations over time. So if someone has an issue in second grade, that's going to change in fifth grade, and that's going to change in ninth grade. So really helping to understand, where are the interventions we have in place working? And if so, then great. Maybe we don't need to change. Maybe we need to change now because the expectations are different, or maybe we need to do more intervention because they're not working as well. So those are those are other things that are kind of addressed in the recommendations in the report. And so for beyond the kind of IEP issue, which probably is the most important concern for most of the people here in this talk, but other things that recommendations might address are, again, issues around transitions. So a lot of times people understandably so, get really worried when the expectations change. So when a child's going from an elementary school setting to a middle school setting where there's many different teachers and different expectations, like we need to kind of adjust our recommendations based on that setting. And for some people, that's middle school. Some people, the bigger transition is as they get older and they have to transition to college. And then, of course, college is going to have a whole new set of rules about how to make accommodations and supports. But that's definitely something that, now that I've been in practice for a while, like, I kind of seen children through all of these different transitions, and the report and the recommendations change. So some of them are just about accommodations. If there's anyone out there who's getting ready for the SATs, a lot of times we need to have very specific recommendations around accommodations for disabilities. Or if your child is becoming an adult, do they meet criteria or for different community supports, different living supports? Is there a need for guardianship? That all of these questions are things that can be addressed in a recommendation section of a report. All right, and this is where, are there any questions?
I was just checking to see if any came in. I don't have any other questions. So if, folks, you do have some questions, make sure you send them in. So we, Dr. Perlis has time to get to them because we are running towards the end of our presentation.
Okay. And so lastly, and I include this only because so many people ask this of me when they call, what is the difference between what the school does and what you do in your evaluation? And that really is going to depend. Some school evaluations can feel a lot like the evaluation that I do. Some school psychologists have training in neuropsychology. I would say the majority don't, but there are definitely some that do. I think one of the way I often explain it is that there is a different purpose to the evaluation. When a child is referred for a child study team evaluation, really the purpose is to see if they qualify for special education, if they meet criteria under one of the disability categories that's in the special education law, and then to develop the IEP based on that. Sometimes we get a really good sense of what's going on and the whys of, so why is my child not reading? Maybe addressed. Will it's not though. We can say, in a school evaluation, they're going to determine whether your child has a specific learning disability and whether they will get intervention. And that's, if they're going to get intervention, that's great. But what the neuropsychological assessment can do is to really help often understand more why. It's just usually, the majority of the time, not always, more comprehensive and more individualized to your particular child. So that's the biggest difference. And I also, I don't only look at, special education diagnoses. I'm looking at that when I'm making recommendations for schooling. But as a clinical psychologist in practice, I'm also using kind of more of the medical model a little bit when I'm thinking about diagnoses, and consider all of those as well. And again, I think that what most people find, is that it's just more comprehensive and individualized and personalized because of the comprehensive-ness of it. And then lastly, what's next? With whom do you share your neuropsychological evaluation? And I usually tell people to share it with the school and the doctors and with everybody. Ultimately, it's your call and what you feel comfortable with. I think that it's meant to be shared, so that way everyone can use the information. And the other question I often get is, how often? When do I need to come back to see you again? And this is also going to be very individualized. The school district evaluates every 3 years, and because I think that's when there's lots of different transition points and different developmental stress points. And usually that's kind of what what people can do in practice as well. Sometimes things change really quickly and people need evaluations sooner. Sometimes I do kind of just follow-ups, not necessarily comprehensive reevaluations, but do kind of follow people if they want to kind of just update some recommendations even without necessarily doing a full evaluation. So.
Well, thank you, Dr. Perlis. This was very, very informative and helpful. And I'm like sitting here like writing notes. You know you said you'll be happy to share your slides, but I'm like feverishly writing information here regarding this, because these are a lot of questions that we get from parents as we're doing presentations. So I know it is very helpful for them. So for those of us that you may have come on late in the presentation, I just want to remind everyone tonight, if you haven't signed up, we have a keynote speaker. It's retired Supreme Court Justice Helen E. Hones, and she's talking about autism after COVID, navigating a world where everything changed and nothing changed. So if you haven't signed up for it, that's a great presentation or address she's delivering tonight. So definitely take some time to check that out. I want to thank everybody for coming today. I want to give everyone some time to get logged off if they're attending the next session, be able to go ahead and log into where they're going to be next. And again, thank you so much, Dr. Perlis. We really appreciate it.
Thank you so much for having me.
Of course. All right, everyone, have a great day.
Bye.
Bye.
Thank you for watching this encore presentation from the Fall 2020 Hinkle, Pryor & Fisher Parent Empowerment Conference. With 24 other presentations to view, there is plenty of additional information to help you become empowered. As a reminder, the information contained in this video is not a substitute for individual legal advice and does not create an attorney-client relationship. Copyright 2020 Hinkle, Pryor & Fisher, PC, Attorneys at Law. All rights reserved.